Quick fact number 5, excessive bleeding per vagina is basically excessive periods. So what is excessive bleeding per vagina? To understand this, just a recap of what is normal menstrual bleeding, what are the two cycles, that is the uterine cycle and the ovarian cycle, which act synchronously for us to get periods regularly, and what is this event ovulation. So this is uterus, fallopian tubes and ovaries. The position of this is in the pelvis of the female. During periods, this uterine lining sheds through the vagina. This is what is periods. The two cycles of the menstrual cycle are uterine cycle and the ovarian cycle. So what is this uterine cycle? Under the influence of certain hormones, the uterine lining thickens and thins out. So why does it thicken? If by chance a baby is formed, it needs a good nutritive bed to come and grow on. So that is why it thickens. But if that doesn't happen in that particular cycle, you shed it as menstruation. So what is ovarian cycle? Under the influence of certain hormones again, one particular follicle of the ovary grows to become big, and at one point of time it ruptures to give us an egg which is inside that follicle. This event of rupturing is called the ovulation. It happens at a particular date in each woman's cycle. So when at that particular time you get sperm, it comes and meets the egg and embryos form, and you know that the uterine lining is ready now. It comes and fits itself there and it becomes a pregnancy positive. If that doesn't happen, like if the sperm is not there or if the sperm is not able to meet the egg, there is no pregnancy and it ends up as a periods. So these are the two cycles. So this is just about the normalcy. Now what is normal menstrual bleeding? It should be regular every 21 to 35 days. That's the range. And every 21 to 35 days when it comes, it should be between 3 to 7 days. And usage of 3 to 4 pads per day with no history of passing periods and no excessive pain during periods. This is normal menstrual bleeding. Anything beyond this range is abnormal menstrual bleeding. So this was the last slide of my quick fact number 4. In that we'll concentrate on if periods last for more than 8 days, usage of more than 5 pads per day, changing pad every 1 hour, if you need double protection like a pad and a tampon or 2 pads together, passage of clots if you have bleeding between the periods or bleeding after the sex. All this is called excessive bleeding per vagina or heavy periods. So now you have one of these and you found out that you or your kid is having excessive bleeding. So you want to go to a gynec. What is it you have to know? There are certain terminologies she'll be using. She'll be asking you for some tests, blood investigations, scans. She'll give you a diagnosis and tell you there are treatment options. So from now on, the slides which I'm going to show you, it's about those informations. It's just informations. There are lots of big words there. You don't need to know all of them. Just know that even such things exist and you need to see a doctor for those. So what are these are some terms which are used in a gynec setup, So when there is excessive bleeding PV, it is called menorrhagia. Pain during periods is called dysmenorrhea. Bleeding and spotting in between periods is called metorrhagia. White discharge per vagina is there for every woman. Every woman will have white discharge with changes in consistency and color over the periods. But if what is excessive, and that is what is significant. Excessive is when it soaks your panties and it is foul smelling. Now I've divided the causes of excessive bleeding age-wise for that so that it is easy for you to understand. There are 5 divisions: pre-puberty less than 8, puberty 8 to 14, reproductive age group 15 to 50, perimenopausal age group, and menopausal more than 50. So 15 to 50 is reproductive, more than 50 is menopausal. What is this perimenopausal? It is a transition phase between reproductive to menopause, which ranges between 4 to 8 years. And why is it important? I'll tell you later. So first is prepubertal, that is less than 8 years. If the kid has bleeding, what could be the causes? So when you're born, when there's a small kid born, girl baby, and it has bleeding, yeah, kids can have bleeding. If it has bleeding, why is it having so? See, when it is inside the uterus of the mother, it is under the influence of so many hormones, high concentration of hormones. When the delivery happens, it's cut off, it comes out of that hormonal environment. So that will cause the girl baby to bleed sometimes. Not all kids, but some kids do bleed. And if this happens, go to a gynecologist, confirm, or a pediatrician, confirm it to be the same, and it is going to stop in a week. The next important cause of excessive bleeding or bleeding in a prepubertal age group is precocious puberty. What is precocious puberty? See, puberty is to start your periods. Suppose you start the period less than 8 years, it's called precocious puberty. Why is it important? Because menarche or a start of a period will cause lots of hormonal changes in your body, and one problem with that is you will have growth stunting. That means you will not grow taller. So that can happen in these kids, and they'll be bleeding in a very less age. Imagine a 6-year-old having periods. She is going to be emotionally disturbed. So these are the problems with a precocious puberty girl, and this is called excessive bleeding per vagina. Then there's something called coagulation disorders. What is this? You walk on the road and you fall. The bleeding stops in 3 to 4 minutes. If that doesn't happen, that means the clotting which is happening, which should happen normally, is not happening normally. And if these things happen the same in the uterus, imagine it doesn't clot, you're going to bleed and bleed and bleed. This is why even coagulation disorders present as heavy periods. Always in this society, we should keep sexual abuse also in our mind. An emotionally disturbed kid who is socially distancing herself and doesn't allow you to touch her private parts and is bleeding now and then, you should think of sexual abuse. So the same thing, precocious puberty, but you have to meet the doctor because her height is going to reduce. So the doctor is going to give you drugs for her to stop the periods so that she can get her normal height and she is not that emotionally disturbed. And after some time, he is going to withdraw this drug so that she can start her normal menstrual period. So this is precocious puberty. The causes for it vary, so accordingly the treatment will also vary. So that is prepubertal causes: during birth, precocious puberty, sexual abuse, and coagulation disorders. Now coming to puberty causes, that is between 8 to 14 years of age. So puberty, you're going to get your periods, right? So during this particular phase, you didn't have periods and you're starting your periods. So there's going to be a major hormonal change. When such a thing happens, your brain, uterus and ovaries doesn't know what is happening. It needs time to adjust. And that is why after the first periods, many kids for 4 to 5 years will not have regular periods. They will have irregular periods, and the periods after 3 to 4 months could be excessive. So this is called anovulatory cycles in puberty, that is 4 to 5 years post menarche. This is there in all kids, but if the bleeding is too much, if it is passing lots of clots and it's continuously bleeding, the kid faints, then it is important for us to meet a doctor. And if the same anovulatory cycles, that means irregular periods with heavy cycles, happen after 4 to 5 years of menarche, associated with obesity, stress, junk food eating habits, you should think of a condition called PCO. What is PCO per se is a large topic. We'll talk to you about it later. But right now, know that even that can cause excessive bleeding PV. Once again, the same coagulation disorders and bleeding disorders. I told you that certain hormones control the brain or uterus and ovary for us to have that regular cycles. And two important hormones in that is thyroid hormone and prolactin hormone. So in pubertal age, if you have this kind of bleeding, the doctor will check for thyroid and prolactin problems. Yes, even in this age group, you should think about sexual abuse. And because of sexual abuse, if she becomes pregnant and they try for illegal abortion, that can also cause excessive bleeding. And if that abortion is not done properly, it can cause infection of the cervix and the uterus. So, for all these three, basically, if you find a kid who's emotionally disturbed, socially distancing herself, with no touch, who doesn't allow you to touch her private parts, who complains of excessive bleeding per vagina with foul smelling discharge and fever, you should always think of sexual abuse. It should never be a surprise. The doctor would want to think about that. So, what is it we need to? These are once again the signs. This is a PCO, that is polycystic ovary, and a kid who presents you with repeated gum bleeds, even without brushing or any kind of fall. If she has gum bleeds and bleeding excessively for a fall, you should always think about coagulation disorders in these kids. This is thyroid, and the hormone from this gland is called the thyroid hormone. This can also cause irregular periods, and this is an emotionally disturbed, socially distancing kid. So we need to identify these symptoms and signs. Okay, so what will the doctor do? He will examine your kid, order for certain blood investigations, ask for a scan of the abdomen and the pelvis. Accordingly, I told you so many causes, medically or surgically, the treatment will vary. I'm not giving you more details on it because each one of them has a different set of medical and surgical treatment. I'm just giving you all this information for you to understand what the doctor is going to do to you once you go to a gynec setup. Next cause is reproductive age group causes. So this is the main bulk of people, that is 15 to 50 years of age, and these people, if they complain of excessive bleeding PV, the first thing which you have to keep in mind is pregnancy related bleeding. Okay, these people, most of them will be sexually active, and pregnancy related bleeding is more common. The first thing is abortion. If a sexually active woman misses her periods for 2 to 3 months, and the periods which she gets after that is too heavy with pain abdomen, always think of abortion. Next is the baby which is formed in the tube should come and fix itself in the uterus for it to grow. If this doesn't happen and it stays back in the tube, it is a life-threatening condition called ectopic pregnancy. Next is molar pregnancy. In this, basically what happens, due to some chromosomal defect, you will have fluid-filled sac-like structures within the uterus, and these people will be pregnant. They present with pain abdomen or bleeding PV. So all these three kinds will have pain abdomen and bleeding. So I don't want you to mug up all these causes. Just understand the fact that in reproductive age group, if the girl misses her periods and complaining of excessive bleeding PV, a doctor is going to ask you for a urine pregnancy test or a blood test for finding out if she is pregnant. Do not be surprised, or do not say I don't want to do it, because you don't know what is happening. There could be pregnancy which we are missing. Okay? So the next important causes are, this is the uterus and this is the uterine lining. If there is overgrowth of these uterine lining, it's called the polyps. These women typically present with periods, bleeding in between periods, foul smelling discharges, heavy periods, and bleeding after sex. So this is also there in many people. The next important cause could be fibroid. So what is fibroid? They're basically muscle growths or masses within the uterus. These women typically complain of heavy bleeding with frequent cycles and pain during periods. They can also complain of heaviness because the mass could grow big. The next cause is adenomyosis. See, this is the normal uterus and this is the uterine lining which sheds as tissues and blood. If this goes into the wall of the uterus, it becomes thick and bloody. So these women complain of severe pain during periods and heavy menstrual bleeding. This is adenomyosis. Always during the later half of the reproductive age group, think of uterine and cervical cancer. These women present with heavy bleeding, foul smelling white discharge, bleeding after sex, bleeding in between periods, and it is mostly in the later half of the age group. Next is infection. This is the normal uterus and the tubes. See, when it gets infected by an organism, they all swell up and become red. They typically complain of heavy periods, which is very painful, passing of clots. They can complain of lower tummy pain, fever, urinary tract infection, and excessive white discharge per vagina. The other causes being once again the hormonal causes, obesity, stress. If there is a copper T inside, they can bleed excessive. Oral pills, if they take, they can bleed excessive. Some drugs like antipsychotic drugs can cause excessive bleeding, liver and kidney disease. It is too complicated for you to keep all of them in your mind. Just find which place do you belong in it. Okay. So what will the doctor do? Take your history, ask for a per vaginal and per speculum examination, ask for an ultrasound or an MRI accordingly, blood investigations. She'll give you a diagnosis, and treatment option would be medical or surgical as per the requirement. Now coming to perimenopausal age group. This is the transition phase between the reproductive and the menopausal age group. So what is happening? You're having periods and you're going towards a phase where you're not going to have periods. So there is a major hormonal disturbance again. So what kind of cycles are you going to get? Irregular cycles with bleeding. So this is an ovulatory cycles again, like in puberty. Then the next important cause why this is important is you're going to collect lots of hyperplasias, that is precancerous condition. These are conditions before the cancer. So why is it important? During menopausal age group, we can catch cases of conditions before the cancer. So if you can do that, the treatment is better than having cancer. So that is why evaluating a perimenopausal lady with excessive bleeding is very important. Then there are cancers and the same rest of the causes like the reproductive age group. So this is normal cervix. This is precancerous lesion. This is cancer. So in perimenopausal, many of them will have this kind of precancerous lesions. And this is uterus, and this is a precancerous condition of the uterus. So by evaluating and finding out precancerous condition, we are avoiding cancer. So what will the doctor do? Will ask for history, per vaginal, per speculum examinations, blood investigations, ultrasound, MRI, and there's some kind of test which is very important here. It's to sample for tissues from the endometrium, from the uterine lining, or they take tissue samples from the cervix. Why? To basically rule out precancerous and cancer conditions. Treatment, surgical or medical accordingly. So next is menopausal age group, that is more than 50 years. What is menopause? Last period and more than 12 months after that you don't have any periods, it is menopause. So no bleeding during menopause. If you have bleeding, always think of cancers and atrophic conditions. What is atrophic conditions? We'll discuss with you again. So cancers, all kind of cancers should be thought of. Polyps, and here many ladies will have many medical conditions like diabetes, hypertension, kidney, liver diseases. So that also has to be ruled out. So what is this atrophy? See, uterine lining, if it thickens, can also cause bleeding, and when it thins out, can also cause bleeding. Okay, and when does it thin out? During menopause. Why? Because the hormones are falling down. So the uterine lining may thin out, and this is called endometrial atrophy. The patient will complain of excessive bleeding, white discharge, and foul smelling discharge. And these are the cancers you have to rule out. What will the doctor do? The same thing. History, examination, scan, MRI, the sampling which I told you, endometrial and cervical tissue sampling, blood investigations, and they would want to rule out medical causes. Treatment, medical or surgical accordingly. So All this is just for your information. If you suppose belong to the age group of 35 to 36, you come under reproductive age group with excessive bleeding. So you can have an idea as to what are the causes of excessive bleeding PV in that particular age group and talk to your gynec accordingly. Thank you.